How is sacral chordoma diagnosed? Imagine experiencing persistent lower back pain that just won't go away, along with some numbness or weakness in your legs. These symptoms might seem like common issues, but they could also be signs of a rare bone tumor called sacral chordoma. So, how do doctors figure out if it's really there? Let's walk through the process. First, a healthcare professional will start with a detailed physical exam. They will check your neurological function, looking for signs like numbness, weakness, or problems with bladder or bowel control. These symptoms are important clues because sacral chordomas often cause nerve-related issues due to their location near the spinal nerves. Next, imaging tests are essential. The primary tool used is magnetic resonance imaging, or MRI. MRI scans produce detailed pictures of soft tissues and are excellent at showing the size, shape, and exact location of the tumor without exposing you to radiation. On MRI, sacral chordomas usually appear as well-defined, lobulated masses that light up or enhance when contrast dye is used. To get a clearer picture of how the tumor affects the bones, doctors often perform a computed tomography scan, or CORT. CORT scans are especially good at showing bone destruction or involvement, which is common in these tumors. While X-rays can sometimes be used initially, they are less sensitive and might miss small or deep tumors. In some cases, doctors might order a positron emission tomography scan, or PET scan. PET scans help assess how active the tumor is and whether it has spread beyond the sacrum. However, because sacral chordomas tend to grow slowly, they might not always show up clearly on PET scans. The most definitive step is a biopsy. This involves taking a small tissue sample from the tumor, usually guided by CORT imaging to ensure accuracy. The sample is then examined under a microscope by a pathologist. This step confirms whether the tumor is a chordoma and helps determine its specific characteristics. It's very important that the biopsy is done carefully to avoid spreading tumor cells or complicating future surgeries. Since sacral chordomas are rare and their symptoms can resemble more common back problems, diagnosis can sometimes be delayed. That's why persistent pain along with neurological symptoms should prompt early imaging. Detecting the tumor early makes treatment more effective and options more manageable. In summary, diagnosing sacral chordoma involves a combination of clinical assessment, advanced imaging like MRI and CORT scans, and a carefully performed biopsy. If you or someone you know has symptoms like ongoing back pain or neurological changes, it's crucial to consult a healthcare professional. They can guide you through the appropriate tests and ensure an accurate diagnosis. Always remember, early detection and specialized care are key to managing rare bone tumors like sacral chordoma effectively.